Hi friends, good evening and welcome to my channel Mookambika Nursing. Friends, in this video we can see some important questions for exam. Here daily I am preparing questions and important points for exam. If it is useful for your studies, please watch my channel and share my videos to your friends and subscribe my channel and support me. We will see today's questions one by one. First question, oxytocin nasal solution contains dash unit per ml. And our option A 20 units, option B 30 units, option C 40 units, and option D 15 units. Correct answer is option C 40 unit. Oxytocin nasal solution contains 40 units per ml. Per ml, 1 ml contain 40 units. And the next question, half-life of oxytocin is. And our options we can see, first option 3 to 4 minutes, option B 7 minutes, option C 10 minutes, option D 2 hours. Correct answer for this question is option A 3 to 4 minutes is the half-life of oxytocin. And the next question, at which temperature oxytocin should be preserved unless it loses its effectiveness? And our option A 2 to 8 degrees Celsius, option B 10 to 12 degrees Celsius, option C 36 degrees Celsius, and option D 1 to 2 degrees Celsius. Here correct answer is option A 2 to 8 degrees Celsius. So oxytocin should be preserved at 2 to 8 degrees Celsius. Which of the following activities should be encouraged after contrast-based CT scan? And our options, first option ambulation, option B drinking of fluid, option C eating high fiber diet, and option D none of this. Here correct answer is option B drinking of fluid will come correct. Okay, so once the contact is injected, that will be excreted through the kidney. So we have to drink lots of fluids. If it is not excreted properly, that will affect the kidney and that may cause nephrotoxicity. So before administering this contrast to the patient's kidney function test should be monitored. If it is normal, we can inject contrast to the patient. That is also important point. Here option B drinking of fluids is the correct answer. Next question, the slight downy distribution of fine hair over the neonate body is called. Options are option A erythema, option B Wernicke's gaseosa, option C milia, and option D lanugo. Here this is an easy question, so correct answer is option D. Lanugo is the slight downy distribution of fine hair over the neonate body. This lanugo starts in 16th weeks of pregnancy and slowly it decreases when the baby is matured. Okay, that is lanugo. And milia means it's a white patches over the face, behind the nose and all. That is milia. Erythema means it is a redness. And another one option is there, Wernicke's gaseosa. That is white creamy or cheese-like covering that protect the baby skin. That is Wernicke's gaseosa. The next question, which routine test will be performed during the client visit at 24 weeks of gestation? And our options, option A Coombs test, option B glucose tolerance test, option C pap smear, option D a rubella titer. And the correct answer for this question is option B glucose tolerance test. This glucose tolerance test is one of the confirmative tests for gestational diabetes mellitus. Okay, this is a normal routine test which will be carried out from 24th to 28th week of gestation. The weeks is important. It is carried out from 24th to 28th week of gestation as a routine test, and it can do up to 36 week of gestation. Okay, if a high risk pregnancy occurs means this can do in early weeks, that is from 8 to 10 week of gestation, that is glucose tolerance test. Here option B is the correct answer. Next question. The mother of a child with hemophilia asked the nurse that which among the following counter medication is suitable for her child's discomfort. And our options: option A ibuprofen, option B acetaminophen, option C acetyl salicylic acid, and option D naproxen. Here question is, the mother of a child with hemophilia asked the nurse that which among the following medication is suitable for her child with discomfort. That is the question. So this hemophilia is a inherited bleeding disorder which occurs due to deficiency of clotting factor 8 or 9 or 11. If it is 8, clotting factor 8 is antihemophilic factor A. Clotting factor 9 is Christmas factor or antihemophilic factor B. Clotting factor 11 is plasma thromboplastin antecedent or antihemophilic factor C. So here the hemophilia, which drug can give to the child with discomfort? That is the question. So ibuprofen is a non-steroidal anti-inflammatory drug. That drug may cause bleeding. There is a chances of bleeding. And acetyl salicylic acid is there, for example aspirin, that also there is a chance of bleeding. And naproxen also contraindicated during hemophilia. Here safely we can administer acetaminophen, that is paracetamol, plain paracetamol we can administer to the child. Option B is the correct answer. Move on to the next question. Which of the following medication should be administered if a child is diagnosed with lead poisoning and chelation therapy is prescribed? Under options, first option calcium disodium iodate or EDTA, option B sodium bicarbonate, option C activated charcoal, and option D none of this. Here question is, which of the following medication can give a child diagnosed with lead poisoning and is on chelation therapy? Okay, so the lead poisoning is also known as plumbism. And for this lead poisoning, chelation therapy along with EDTA is used to treat this lead poisoning. So our answer will come calcium disodium iodate, EDTA. Option A is the correct answer for this question. And the next question. Maternal intake of tetracycline result in which effect on lactation and the neonate? Options are option A no significant effect, option B tooth staining, option C anorexia, and option B safe drug. So here correct answer is option B tooth staining. Maternal intake of tetracycline cause staining in the tooth or discoloration of the tooth. Which among the following can cross the placental barrier? And options are option A heparin, option B insulin, option C A and B, and option D anticonvulsant drug. And the here correct answer is option D anticonvulsant drug. During pregnancy, anticonvulsant drug is contraindicated and it can cross the placenta. Okay, so option D is the correct answer.